Hi, it's Regina DNP, and I want to welcome you as we discuss ADHD, Attention Deficit Hyperactivity Disorder. With this particular disorder, we are going to talk about the DSM-5, the Diagnostic and Statistical Manual of Mental Health Disorders. This particular manual is very important because a lot of mental health professionals use this manual as a guide, a basis to diagnose mental health disorders. So, the DSM-5 helps assist clinicians. That's going to be your psychiatrists, psychologists, nurse practitioners, physician assistants, your licensed counselors, anyone who actually assists with mental health diagnoses. It assists us to conduct clinical assessments, case formulation, and treatment planning. This guide is also looked at by the legal world because it helps them make decisions on competency and disease processes. So, ADHD follows in line with what we see as neurodevelopmental disorders. So, this is the first section that you will see in the DSM 5 book. So, you will see that includes intellectual disability, language disorder, childhood onset fluency disorder, aka stuttering, autism spectrum, attention deficit hyperactivity disorders, and of course, motor disorders, also known as tics. There are screening tools that can be used to assess for attention deficit hyperactivity disorder. One of the things we look at in the DSM 5, we look at definitions and what the guide says. So you will see with ADHD, there is a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development as characterized by these next two. Criteria number one is inattention. Six or more of the following that have persisted for at least 6 months to a degree that is inconsistent with developmental level and negatively impacts directly on social and academic or occupational activities. This particular person usually fails to give close attention to details, or they make careless mistakes in schoolwork, at work, or during other activities. They may overlook details or their work could be inaccurate. They often have difficulty sustaining attention in task or play activities. So they have difficulty being focused during lectures, conversations, or lengthy reading materials. They don't seem to listen when spoken to directly. Their mind may seem elsewhere, daydreaming. Often they don't follow through on instructions. They may fail to finish schoolwork, chores, or duties in the workplace. They could start a task, but quickly lose focus and are easily distracted. They often have difficulty organizing tasks and activities. So sometimes they have difficulty doing sequential tasks, keeping materials and belongings in order. They could be messy, have disorganized work, poor time management, fail to meet deadlines. They also may avoid, dislike, or they're reluctant to engage in tasks that require sustained mental effort, like schoolwork, homework. For older adolescents and adults, it may be preparing reports, completing forms, or reviewing or reading lengthy papers. They often lose things necessary for tasks or activities like schoolwork, pencils, tools, wallets, keys, eyeglasses, mobile phones. Can be easily distracted by extraneous stimuli. So, like for older adolescents and adults, it could be just their mind just wanders off on something totally unrelated. Can be forgetful in daily activities, so doing chores, running errands. And for older adults and adolescents, it could be returning phone calls, paying bills, or even keeping appointments. So remember with ADHD, this is criteria one. So it could affect this one and number two, or just this one, or our second criteria. Okay, here's our second criteria: hyperactivity and impulsivity. You will see a person needs six or more of the following symptoms that have persisted for at least 6 months to a degree that is inconsistent with developmental level and negatively impacts directly social and academic or occupational activities. Now, for older adolescents and adults, they just need to meet at least five of these symptoms. So you will see this person could fidget or tap their hands or feet or squirm in their seats. They leave their seats in situations when remaining seated is expected. So, like leave their place in the classroom, in the office, or other workplace, or in other situations that require them remaining in place. Often runs about and climbs in situations where it is inappropriate. Now, in adolescents or adults, this could just be them feeling restless. I'm often unable to play or engage in leisure activities quietly. It's often on the go and acting as if they're driven by a motor, like they're unable to be uncomfortable, or just sitting still for an extended time, like in a restaurant or in a meeting. Often talks excessively, often blurts out an answer before a question has been completed. They can't wait for their turn in conversation. Often has difficulty waiting his or her turn, like waiting in line. Often interrupts or intrudes on others. So they may butt into conversations, games, or activities, may start using other people's things without asking or receiving permission. For adolescents and adults, they may also intrude or take over what others are doing. Okay. Other helpful findings that can help with a diagnosis of ADHD includes several inattentive, that was number 1, or hyperactive impulsive symptoms, which we just saw in number 2. These were present prior to the age of 12 years. There could be several inattentive or hyperactive impulsive symptoms present in two or more settings. So, at home and school, school or work, with friends or relatives, in other activities. So, at least two or more settings. That there is clear evidence that these symptoms interfere with, reduce the quality of social, academic, or occupational functioning, and that these symptoms do not occur exclusively with schizophrenia or another psychotic disorder. When we talk about the prevalence of ADHD, you will see it occurs in most cultures, in about 5% of children and 2.5% of adults. It is difficult to diagnose ADHD before the age of 4 just because of just behavioral and normative, behaviors that you will see in that particular stage. Now, for risk factors, we will see the temperament. So, ADHD is associated with reduced behavioral inhibition, effortful control, or constraint. Also, when you look at environmental factors, very low birth weight babies, less than 1,500 grams, they have a 2 to 3-fold risk for ADHD. But, most children with low birth rate do not develop ADHD. But there is a possibility of predisposition. When we look at genetic and physiological factors, if you have a first degree biological relative with ADHD, there is a higher probability that it can be inherited. With any mental health disorder, we as mental health professionals will always look at what we call differential diagnoses. This is what other possibilities could be going on. So, with ADHD, before you do the official diagnosis, you want to see, could this be oppositional defiant disorder? intermittent explosive disorder? Could it be a different type of neurodevelopmental disorder? Is there a learning disability? Could it be autism? Is there any anxiety, depression, bipolar disorder, substance use? Could it be medication induced? So, we must look at the differential diagnoses before we make a diagnosis. I want to thank you for listening. And remember, professional concierge nursing in Los Angeles does see in person clients, and we do telehealth in Nevada, Texas, and Florida. Have a wonderful day. Remember, your health is your wealth.